Hello. Can you hear?
We can start, sir.
Yes, yes. Can you hear? But I could not see any response.
Hello?
Hello. Can you hear?
Yes, sir.
Okay, fine. Uh, so few people have submitted assignments. So what others are planning? They are planning to present. Is it so?
No,
Hard.
sir.
Very few have submitted the assignments on pain.
Sir, only 4-5 students have not submitted, so they will submit it.
Okay, fine,
Others have submitted, sir.
fine. Now the thing is it clear to everyone about pain? Whether there are any difficulties about that topic, because already we have studied it earlier. We have studied all the drugs which are acting on pain in different chapters. Only thing is you have compiled it now under pain section, uh, this neuralgias you have studied under carbamazepine, isn't it? Then NSIDs you have studied separately at least two or three times. Then you have studied these.
Sir, sir, what is there in neuralgia? We are not getting that topic actually. I found it on Google, but I find different types of it, sir. So actually, what points do we have to cover in that? Would you please summarize in short?
Neuralgias are what? Neura is neuron, algia is pain, because we call the pain reliever as an analgesic, isn't it? So an means which prevent, analgesic again, analgesia is a pain, neuralgia. So neuron related the pain which are related because of the neurons. Now why pain is there because of the neuron? We have seen it in very first introductory class. Some of the neurons are sensitized, or some of these are getting demyelinated, and means basically it is because of some kind of problems related to neuron. Either they are hypersensitive and they carry more pain sensation, or they are damaged, and because of that they are carrying sensation even if there is no such cause of pain, and that is causing into neuralgias. So why any other treatment is not working in that? We have seen in case of trigeminal neuralgia, that is, it is a trigeminal nerve, which is one of the this cranial nerve. This nerve, where it is getting demyelinated, and uh, therefore it is causing more passage, more transmission of the impulses, and in that cases this neuralgia, uh, the normal drugs are not working. Okay, then there are various neuralgias, or they are sort of neuralgias. Example, compression of the neurons which is taking place. Example is a sciatic nerve related problem. If there you can search with the sciatica and the pain because of that, or lumbar pains. Now these are again because of the compression of neurons, and these are resulting from the severe compression which can cause the death of neurons. So in that cases we use the GABAergic agents, those which are having GABAergic activities. Most prominently used is a pregabalin and other GABA analogs. So there are variety of such neuralgias. You can check about it. As I told you, pain and neuron or nerve, you put it there and you put it neuralgias, and you will find different kind of reasons for the pain. This is very popular one, particularly sciatic nerve, and related to that, very commonly these are called as a slip disc. That is, the vertebral column disc are there. They are having cushion like membranes. So these cushions, it is wearing off, and because of that the gap between these vertebra, various vertebra, that reduces, and because of that there is a compression of neuron. So these are various pains. They are commonly called as a various, that is Cervical pain, it is also called as because of the cervical vertebra. Then lumbar pain, again it is because of the lumbar vertebrae, sciaticas. So these are variety of such pains and neuralgias. So different places, because of the damage to nerve, different kind of pain will be there, and this pain will be associated, or this pain will be requiring different kind of medications. So I hope it's clear.
Yes, sir.
Okay. Now I have seen some of these good attempts. That is, what are various causes of pain, and why this pain is there, because of and what are basically, if we you understand the physiology of pain, that what are various consequences which result into pain, and at what level this pain is, how this pain is transmitted or transduced, which is a sort of physiology which you have studied earlier, again while pharmacology and all. So here that is very very important, so that you can and accordingly on the basis of pharmacology you can use the agent for that different kind of pain. You know now variety of pain, particularly stabbing pain, piercing pain, then compression pain, okay, dull pain. So these are variety of pain types you will find, and you can describe these pain types, or you can put again in Google. Those who have not done, or those who can put it in revision, they can do it. So various categories of pain. Dull pain, we have seen this dull pain is because of the C type of fibers, and that is the best taken care by opioid and it is basically a visceral pain. So when it is such kind of pain, usually uh, these opioids are preferred. Then when it is a chronic injury pain, again C type of neurons are also simultaneously there, and therefore post surgical conditions, initially NSAIDs are also used, because NSAIDs are in initial phase they are more active, and in later phase opioids are used. So we have seen variety of such pain, uh, what we can say, pathways and various agents which are acting on pain, and on that basis how the pain is being carried, what are various mediators of the pain, accordingly we can tackle with that. There are many many pain related or what we can say pain modulators, or pain related neurotransmitters are there, various chemicals are there. So if we tabulate them, in what condition they are released, and in particularly in which condition they are more active, and what kind of pain they are carrying, then it becomes easy for you for to think about treatment. The next thing in again pain is, once you know various thing related to pharmacology, you have studied various drugs in that. Example, you have studied all NSAIDs. Okay, so again you revise this NSAIDs, you have a tabular what we can say presentation of or tabular writing of this, which is NSAIDs. Basically it started with aspirin, and then we have got so many of them. We have got aspirin, we have got paracetamol, we have got ibuprofen, we have got diclofenac, we have got then piroxicam, tenoxicam. Okay, there are so many classification we are having NSAIDs, and each of them are having their own pros and cons, because in therapeutics our aim is basically to give the best medication. So here we cannot say that since it is a stabbing type of pain, or pain because of the injury which causes release of prostaglandin, so we can use any prostaglandin inhibitor. Because if you study this pharmacology, you will find that basically most of these agents, they have three type of actions, only that is getting modulated. If you remember this example, there are three important activities. First is they are analgesics, second is they are anti-inflammatory, and third are they are antipyretic. They all these three activities are because of their prostaglandin synthesis blocking effect. So they block prostaglandin synthesis, and by virtue of this prostaglandin synthesis they show all these activities. Now once we know about this, that example, we know aspirin was having comparatively higher analgesic activity, and it was very popular as a painkiller medication, but later we found that because of variety of activities, there are more than 3 type of actions because of it which is causing more gastrointestinal bleeding and ulcers. Even your last time presentation we were discussing that NSAID induced, etc., and aspirin is the most prone agent for that. So this is all pros and cons you are supposed to know before selecting the NSAIDs. And nowadays the aspirin is no more used as a analgesic or anti-inflammatory agent, and is particularly reserved as a agent which is blocking the synthesis of thromboxane A2, which is very hazardous in case of cardiovascular problems or thrombotic diseases. So this is what you have learned in pharmacology. Only thing you have to apply it. Then example is next is paracetamol. You know that paracetamol is what? Paracetamol is comparatively having very high activities as a antipyretic agent and comparatively less activities as a what we can say then analgesic, and almost minimal activities as an anti-inflammatory agent. So these are known to us. On that basis you categorize them so that you can understand that in what conditions. Suppose the pain is because of the injury. Whenever there is an injury, then along with injury, whenever there is inflammation, so pain and inflammation both are simultaneously existing, then you have to select the drugs like ibuprofen, which are having good this anti-inflammatory activity. So this is what basic knowledge should help you in selection of drugs, and accordingly you can go for that. You might have studied all variety of drugs, example of these including diclofenac and newer, as I told you, tenoxicam, piroxicam, etc. Then these newer agents which are acting on, which are available as a COX-2 inhibitors. So there are so many agents which are available, and accordingly what we can select with what should be our selection criteria, it should be known to us. Same is the case with the morphine or opioid analogs. We know because we have studied in detail. We have got variety of these drugs which are acting on different receptor, mu, kappa, delta, sigma, and on that basis each of these are having different activity which are having more with mu, more with kappa, more with delta, more with sigma, and on that basis they have different activity. Mu are comparatively more important in analgesia, and we have seen that they have got very typical adverse effects, typical side effects, particularly abuse potential they have got because of the euphoric effect, and some of these are actually substances of abuse, example heroin basically, which is in that class only. So we know about it. You have studied it under pharmacology. That is what I was expecting to you, that you should revise, and if you have any difficulty you can ask me. So once you do this, then it becomes easy. You know now what pain is, why pain is. We have studied it, that pain is a sort of physiological response which gives you indication, which gives you idea about some kind of problem associated with that particular portion, that why there can be inflammation, why there can be pain, why there can be what we can say particularly feeling. And then basically in any kind of pain, since just like if you remember, we have seen in earlier case jaundice. Jaundice is a symptom, or earlier in second year we taught that angina, in that angina means pain, and pain is a again symptom. Angina is not a disease. Angina is a symptom, and symptom of what? It is a symptom of coronary artery insufficiency. So this is what we understand. Basically our understanding becomes clear. Similarly in pain also, when there is a pain, our immediate attention, anybody's immediate attention should go for the cause of pain. What is the cause of pain? If it is known, then you can relate with the type of injury and type of pain. Okay, suppose because of trauma somebody falls down and there is a what we can say, muscle injury, which is not seen from outside, but we can understand because of the we can mechanical injury, we call it as a. Okay, then another is some object get pierced, maybe while doing something, or by any mistake, maybe knife or some object that causes cut to the uh, body area, and then that is again another reason. So then there is a some infection which is there, which is causing tissue damage, and because of tissue damage, there is again release of various mediators. They play very very important role in inflammation, and inflammation is very very important physiological mechanism for identifying the tissue injury and the repair of that tissue. That plays very important role. Then you understand what can be the reason. Accordingly, it may be infection. You might have seen those who have got some boils, etc. Then pain will be there because sensitization will be there, or pus is formed, etc. So these are all various ways, various reasons why there is a pain. Then there can be because of compression, because of one or other kind of, may be inflammation, may be tumor, may be some other reason, and because of the compression, this is again mechanistic type of cause that causes pain. So those who have not done it, or those who want to revise, they just go through it, repeat again, do it again, check out what are various the etiological factors for pain, and how pain is very very important in identifying the cause. So next very important thing is we have to treat the cause first if it is there. Suppose if it is injury, then we should see that, because injury actually we do not give any drug for healing of injury. We give drug to avoid any kind of infection, because at that time our barrier function of the skin is lost, and in that microorganism can easily go inside and they can thrive, and therefore our immediate role is to give antibiotic on that particular area. Some people, they do give anti-inflammatory also when the pain and the inflammation is too much, because that area becomes tender. We know tender. Anybody know what is tenderness? Okay, search it, find it out what is tenderness, what in our medical parlance. Okay. So then that is identified, that is checked, and on the basis diagnosis is made, and if it is required, then pain, what we can say, analgesic agents or the drugs, they are commonly called as a painkillers, can be given. So this is how basically pain has to be or pain relieving should be done systematically. Identify the type of pain, identify the cause of pain. Means that there is always causal relation between type of pain and cause of pain. So identify this type of relation. Once you know the cause, you check it out whether you can remove the cause, whether you can treat the cause first, because we know pain is a secondary to a cause. When you do not understand it but still pain is persisting, we call it as idiopathic pain. Go for the type, depending on the signs, symptoms, plan it out what kind of pain it is, and accordingly we know you have got the list of various agents which are working. Example, trigeminal neuralgia, initially we can call it as idiopathic until and unless you completely finally diagnose it with the typical signs that neuralgia is having. Okay, because there is no injury, no stabbing, and persistent pain is coming from that area, or even initially when you find that there is a pain in lumbar or cervical or any other reason, so you should try to relate with the reason. There can be several reasons. Okay, there can be many reasons for pain, and each pain is different than okay, or different types are we can have categorized, classified on the basis of what kind of cause it may be having. So accordingly, once we go for that treatment, our treatment will be totally based on this is what rational treatment is. Go for cause first, or you try to correlate the type of pain and cause of pain. Try to see if you can identify the or you can establish the result this relationship properly between cause and between the type of pain which is occurring. On that basis you can plan about medications, or as I told, the first one is to relieve from the cause if possible. If it is tumor, then you have to get it relieved. Now rheumatoid arthritis itself is a pain, but you know what is the causal relation, that is it is because of the problem with the joints, that is synovial fluid depletion and presence of autoimmune antibodies which are affecting, and because of that the problem is there, and the treatment therefore is different. Apart from painkillers, the treatment is such kind of anti-inflammatory agents. So then your anti-inflammatory agent changes accordingly. Instead of going for COX inhibitor, COX-1 or COX-2, then people also try to add glucocorticoid like agents which are also anti-inflammatory agents. So if you reduce the inflammation, you can reduce pain also. And there are if you remember rheumatoid arthritis, we call them as the drugs like DMRDs, that is disease modifying rheumatoid arthritis drugs are there. So these are various drugs basically which are having activity on immune system. They are immunosuppressants, most of them are, and these immunosuppressants will reduce this autoimmune type of activity, and thus it can be reduced. So most important, what I mean to say is what, that the pain identification is important. There can be several reasons for the pain. Once you understand what is the reason for the pain and you identify, you can establish the causal relationship between type and cause of pain, then you know that what kind of treatment it requires, and accordingly you are going to use various kind of treatment for pain or inflammation which is simultaneously. Most of time they are hand in hand, and that is pain, inflammation and pyrexia, that is increase in the body temperature. Most of the time they are coming hand in hand because prostaglandin release is there, and when pain is too much then you are planning or you are shifting towards this opioid analgesics, and the pain is from different reasons. Then you have got different agents like maybe for trigeminal neuralgia we have seen carbamazepine or pregabalin like agents or GABA agonist like agents. Then the drugs acting on various other pain sensitizers like substance P and all other. This is very important. Just go through this. If you have any difficulty, you can ask about it. The next thing is we'll go for headache. Again, whenever any kind of disease, the last topic in this is headache, I think. So go for this again. What are various kind of headaches? Some of these you have studied under different conditions. Example, migraine you have studied when you studied the drug acting on 5-HT, that is, or serotonergic drugs you have studied, and in that you have studied various tryptamines. Then this again this is a different way of pain, and this is different cause of pain. Here you are relieving the cause of pain in case of migraine, and therefore your treatment for pain is different. So here we have got different headaches. There are many varieties of headache. Thousands of varieties we can have about headache, and it is the having symptom of headache means what? Symptom of pain in the face, head or neck. These are basically headache. That means headache, and it can occur as a migraine, which you have studied earlier. Then there are other, then we call as a tension type of headache, which many of people they face about it whenever they get stressed. पढ़ाई नहीं हो रही, असाइनमेंट किया नहीं था सर ने बोला, तब फिर उसमें से कुछ पूछ लिया, फिर हेडेक हो जाता है ना. सो दिस इज कॉल्ड एज a tension type of headache or cluster headache. And what is the problem with headache actually, or whenever pain is there, any kind of pain, if you remember, we have seen it earlier that whenever there is a pain, then it disturbs the normal quality of life of the person. Even without any reading theory, you can explain about it, because those who have experiences pain for any kind, any reason, at any place, they can tell you. Example, epigastric pain I can tell you about. Epigastric pain is what? It is because of the hyperacidity, which almost everybody at least once in a life gets it, at least for maybe for very transient period, but gets it. So that is again different pain, but we do not give any painkiller for that, because if we relieve it, that epigastric pain is relieved. That is very different kind of sensation it is having. Then there are colic pains, okay, and because of that we have got antispasmodic agent that can relieve the pain. So pain are variety of pain you have got. Pain because of spasms, pain because of such kind of irritations, pain at multiple levels they are there, and accordingly we can have treatment. Now as we were discussing about headache, the symptom of pain which is in face, head or neck, it can occur as a migraine headache, it can occur as a tension type headache, it can occur as a cluster type of headache. Now what is the problem with that? Why we cannot live with headache? Because whenever any kind of pain, as I told you, that changes the quality of life. The change in the quality life means the person cannot pay attention in other activities, and the whole attention goes toward that pain. Once it goes, then the working is affected. More you pay attention, more feeling of that pain will be there, and if it continues, even person, they will be deprived of sleep. If they are deprived of the sleep, again that is a sort of, we call it as a vicious cycle, that is from one again next day, because of the lack of sleep, lack of rest, the person will feel still more discomfort, more sensitized, more irritable, and the problem can aggravate is one thing. We have seen earlier during our psychiatry topic that if the persons are deprived of sleep and if constantly subjected to pain, they are more prone to have the chances of depression. So again, if that goes on, then person get depressed, and the what we can say, consequences of depression. So there are many reasons are there why there can be headache. As we have seen that any pain has got multiple reasons, and we have to try to find out the cause, and accordingly we have to go for the treatment, because we don't have the single medication for all kind of pains. We have seen this, and accordingly we have to select it. It can occur as a result of many conditions. Many type of different classifications are there, and the most widely recognized is classification is from the International Headache Society, that gives about the classification of various headaches, and it can be because of a variety of reasons, as I told you. It can be just like migraine we have seen, or tension, then other we have seen. Even apart from that, it can be because of dehydration, headache one can get, fatigue one can have, sleep deprivation can cause headache, and this is a cycle, as I told you. Headache will cause sleep deprivation can cause headache, and accordingly stress, effect of various medications it can be there, the effect of various recreational drugs. Example, those who know about it, the very common word is there, that is called as hangover after alcohol drinking. So this is the recreational drugs. Viral infection, loud noise. Yes, loud noise is a stress, if you or you call it as a noise pollution or sound pollution. Common clouds, common colds, then head injury, rapid ingestion of very cold food or beverages because it can constrict the blood vessels at many places, dental or sinus issues like sinusitis. So accordingly, as I told you, there are multiple reasons, and accordingly you have to find the cause. The treatment will depend on the underlying cause, but usually pain medications are given. We call them as a analgesic drugs can be given. The most commonly experience of all this is because of these discomforts are there. So this headache, which is very common, and the cause wise, as we can see, there are more than 200 types of headaches. Of them, some are harmless. For some time they will come and then they will go, while some can be life threatening, some can be very dangerous because they continue, not only continue, they can increase their activity, and therefore slowly that pain can become unbearable if it is not there. And therefore whenever the pain is there, one should go for the neurological examination, check out the cause, whatsoever diagnostic tests are required depending on the cause, if it is migraine or if it is cluster, whether it is type of tension or any other such type, then go for correct diagnosis, and on that basis go for the treatment as per previous one, or on the basis even in pain also. Here also, as I told you, we have got classification is on the basis of whether it is primary, secondary. Primary are benign recurrent headaches, and they are not caused by any underlying disease or structural problem. Example, migraine is a primary type of there, and the primary headaches, cluster headache, tension headache, these all are primary. While primary headache, they may cause significant daily pain, disability, they are not dangerous from a physiological point of view. While secondary are because of certain underlying disease, and that has to be identified, and out of that some of the underlying problems can be very dangerous and very severe. Example of these are infections, head injury, vascular disorders, brain bleed, stomach irritations or tumor, which causes indirect sensation towards brain, and you feel that pain is there in brain. Secondary headaches can be dangerous, and therefore certain red flags or warning signs, they indicates that these secondary headaches must be taken care of at earliest. So most of time they are actually the primary headaches, and usually first start when people are between 20 to 40 years old. Most common type of primary headaches are the migraines and the tension type of headaches. They have different characteristics. Migraines typically present with the pulsing head pain, that is it comes and goes for time, that is it comes in a pulsatile formation. Nausea, photophobia, that is if light is there, then the person will have a very typical activity. Then sensitivity to sound, that is called as a phonophobia. These are very typical, and there is aura. We shall see separately about migraine and different type of headaches. If you can go for, because you have studied it earlier, you can make a small write-up of it, classifying different kind of headaches. That is migraine. Tension type usually present with non-pulsatile band-like pressure on the both side of the head, and it is not accompanied by symptoms. Another rare type of primary headaches, they can be cluster headaches, which are for short time but severe pain, usually around one eye, with autonomic symptoms like tear, red eye and nasal congestion, and that occurs same time every day. It means it has got a fixed time period. They can be treated with the triptans also, and just like migraine, and prevent with the corticosteroids and other such agents. We shall study about this. Then trigeminal neuralgia or occipital neuralgia, that is cause shooting face pain. We just introductory, when Pratima asked question, we discussed about neuralgias. Then hemicrania continua, it is a continuous unilateral pain, one side pain with episodes with the severe pain, and it can be relieved by the medication like indomethacin, which is prominently helpful. Indomethacin is also one of the NSAIDs. Primary stabbing headache, recurrent episodes of stabbing, ice prick pain, that is somebody speaking, making the stabbing or that, or jabs and jolts for 1 second to several minutes without autonomic symptoms like tearing, red, nasal congestion, and again this can also be treated with the indomethacin. Then primary cough headaches, they start suddenly and they last for several minutes after coughing, sneezing or straining. Straining means anything that may increase the pressure on the head. Severe causes like secondary headaches, it must be ruled out before diagnosis of benign primary cough headache can be made. So go for various testing and get it confirmed that it does not have any kind of benign problem. Then exertional headaches, it gives throbbing pulsatile pain which starts during or after exercising, lasting for 5 minutes to 24 hours. The mechanism is not clear, but it may be because of the straining, it causing the veins in the head to dilate, it causes pain. And these headaches can be prevented by not exercising too strenuously and can be treated with the medications like indomethacin. So we have found that indomethacin can be treatment for many of the as NSAIDs, can be problem with the many kind of simple type of pain which is not very complicated. Then primary sex headache, dull bilateral headaches that starts during sexual activity and becomes much worse during the last portion. These headaches are also thought to be due to lower pressure in the head during sexual activities, and it is the important to realize that these headaches are to beginning during the end of the sexual this one. It may be due to the subarachnoid hemorrhage. In some cases it may be like the cat, and therefore it has to be verified that whether such kind of activity is there. They are treated by advising patient to stop the activities if they develop headache, and medication like propranolol or diltiazem, that can be helpful. Okay, propranolol is a beta blocker and diltiazem is a calcium channel blocker, that can be helpful in this kind of headache. Then hypnic headache, moderate to severe headache that starts after falling asleep and it lasts to 15-30 minutes. It may recur several times during night. They are usually in older women and it may be treated with lithium. So these are all a variety of primary headaches. Then secondary headache, they can be caused by problems which are there in the elsewhere or neck. Some are not harmful, but some can be their example is cervicogenic headache because of the neck muscles. The excessive use of painkiller can paradoxically cause worsening of the pain, and we call them as a painkiller headaches, or it is also called as rebound headache, that is because of too much painkillers. When painkiller is not being used, then body feels to have painkillers again, and then this painkiller headaches can be there. Very severe causes of secondary headaches can be meningitis, that is inflammation of meninges, and it may be because of either infection or any other such reason, or stiff neck. Then bleeding inside the intracranial hemorrhage or bleeding inside the brain. Subarachnoid hemorrhage, that acute severe headache and stiff neck without any fever. Ruptured aneurysms like arteriovenous malformation, intraparenchymal hemorrhages, that can cause headaches. Brain tumors can cause dull kind of headaches. They works with the exertion and change in the position. They are accompanied by nausea, vomiting, and often person can have nausea, vomiting for weeks before the headache starts. Temporal arteritis, inflammatory diseases of artery, average age of 70 or more people can have it. Fever, headache, weight loss, this can cause, and glaucoma can also cause headache in the people. So these are then after seizure, some of the people can have, we call it as a post-ictal, that is post seizure various. Then even ulcers can cause headache, and even IBDs, that is we have seen inflammatory bowel diseases, So some of the gastrointestinal problem can result into headache. So this is what variety of headache which can be there, and on the basis whether it is primary or secondary, accordingly we can go for that. And this can be treated accordingly. If, as I told you, it can be primary or it can be secondary. There are a variety of causes, and accordingly we should go for that. Brain itself does not have any uh, these receptors, because it is totally protected and it is full of neuron, but it lacks pain receptors. But the head and neck, they have pain receptor and they cause pain. So they cause extracranial place, then middle meningeal artery, large veins, then various sinuses. They are having different kind of thing. And again, particularly, though brain does not have direct pain receptors, but the release of various pain mediators, you have seen it, you might have studied it when you submitted all these assignments. So when they are released, then these release mediators, they invoke the pain sensations. So these are variety of pain, and we shall see about what are the details about various pains and various reasons. So these primary headaches will see in next class. That is what is migraine, what is cluster type, and what is tension type of headache, and what is the treatment, and how we should diagnose it. Okay, so this thing will go for in our next class. If you have difficulty, by the time you can go through and just have a, you get the assignment completed on the way, or the by the what we can say, points whatsoever I have suggested you. You use these points, and if you have any difficulty, you can ask it. So take care and be careful. Okay.